Samani and we are Team K. Our topic is on Chapter 10 about mental health services. I will now proceed and read the case scenario. You are newly graduated from pharmacy school and have taken a position in a community pharmacy setting that is near a community mental health center. Many of the clients of this center come to your pharmacy to have their prescriptions filled. In pharmacy school, you learned about treatments of mental illnesses, but were never taught how to interact with people with mental illnesses. You understand that empathy is a part of your professional demeanor, but you find you have beliefs about people with mental illnesses and their ability to understand your patient counseling efforts. Occasionally, pharmacy technicians interact with these patients and you feel uncomfortable with the jokes and laughter that sometimes follows these patients' visits. On one occasion, DL, a 42-year-old man with chronic paranoid schizophrenia, comes to the pharmacy to pick up his antipsychotic prescription. It is apparent that he has not been taking care of himself and is becoming more ill. On previous visits, the pharmacy staff has simply handed him his prescription without offering to discuss it with him. When DL approaches the counter, you move to the window to dispense his prescription. You ask him how his medication is working, if he has any problems, and if he recognizes the pills that he has previously taken. He does not look at you and seems very surprised that you would take the time to speak to him. Upon further questioning, you realize that DL has tremors in his hands and has difficulty finding the words to express himself, although he tries. You review his medication with him, including the fact that his tremors may be due to his medication, and that he should talk to his physician about this, and that there are treatments available. He thanks you and leaves the store. Several days later, DL returns to the pharmacy to pick up a prescription for a medication to treat his tremors, and again thanks you for the time you took to explain his problem to him. You realize that taking the steps to engaging DL and providing him the encouragement has caused him to make an effort to take care of himself. You also provide your technicians and coworkers with a model for your expectations in working with people with mental illnesses. Now Miranda will talk about mental health epidemiology.
Hello, my name is Miranda. I'm talking about mental health epidemiology. Mental health epidemiology has become a widespread problem. It is estimated by the World Health Organization that approximately 450 million people are suffering from mental and behavioral disorders. 25 million of those people suffer specifically from schizophrenia. Annually, more than 5% of adults in the United States have a severe mental disorder, including schizophrenia, major depression, panic disorder, and manic depressive disorder. Depression, alcohol use disorders, bipolar disorders, schizophrenia, and substance abuse disorders are among the top 20 leading causes of disability. These disparities in mental health are especially high in at-risk populations, which includes cultural and linguistic minorities, rural populations, and women and children who have lower socioeconomic statuses. This is because they are more likely to delay or not seek mental health treatment, receive inadequate treatment, or terminate their care early. They also have higher rates of prescriptions for psychotropic drugs. Homelessness is also a major problem in patients with mental health disorders. Approximately 26% of individuals who are homeless have a serious mental disorder.
Hi, my name is Samantha and I will be talking about medication adherence and mental health. Medication adherence is a significant problem for people who suffer from chronic medical illnesses. Often it is assumed that people with mental illness have greater non-adherence than those with medical chronic illnesses. This is not true. Studies show that any chronic mental illness patient doesn't take approximately half of the doses they are prescribed. This study was done by Haynes, Alaco, Sahota, McDonald, and Yao back in 2008. Reasons for non-adherence are lack of insight of the severity of their condition, unable to pay for their medications and care, unstable housing and support, unstable support systems, and lack of access to care. Studies show improving medication adherence decreases hospitalization and acute care of mental health patients, specifically in schizophrenia patients. The role of the pharmacist in mental illness medication adherence is improving and expanding. Patient outcomes show improvement in symptoms of patients who have pharmacists who gave extra support versus those patients who got usual normal care from their pharmacist. It is important for a pharmacist to question the patients about their medication use in a non-judgmental way to ascertain the adherence. It's important for this because the pharmacist can build an alliance with the patient so the patient may feel in control of their treatment and their treatment options. The practice of psychiatry is becoming a more complex entity. Community pharmacist positions are also becoming more complex because of this. And now, Paula is going to come and talk about mental health teams and the role of the pharmacist.
Hi, my name is Paul Simpson, and I'm going to talk about mental health teams and the role of the pharmacist. Now, a typical mental health treatment team consists of around 8 different members. Now, some of these include a psychiatrist, a clinical nurse specialist, a psychiatric nurse, a social worker, therapist, psychologist, a care manager, and then finally a clinical psychiatric pharmacist. Now, what does a clinical psychiatric pharmacist actually do? Well, they play a pivotal role in many treatment settings, including VA hospitals and clinics, and also university teaching hospitals and clinics as well. Now, some of the potential responsibilities include medication management, and this includes initiation and adjustment of therapy, laboratory monitoring, authorization and monitoring of prescription refills, interaction with the treatment team, and billing insurance plans for services in some states as well. And the role of the clinical psychiatric pharmacist has expanded since the turn of the century. And a large contribution is because of the Board of Pharmaceutical Specialties. They initiated a board certification examination in psychiatric pharmacy. Now, eligibility for this examination requires graduation from an accredited school of pharmacy or college of pharmacy, and either have a minimum of 4 years of experience in primary practice in psychiatric pharmacy, or complete a postgraduate year 2 psychiatric pharmacy residency. And so far, over 500 clinical pharmacists have received the designation of board certified psychiatric pharmacist. In rural areas, clinical psychiatric pharmacists work with primary care physicians as physician extenders to act as a psychiatric provider for patients in an outpatient environment. The community pharmacist is in a unique position to provide mental health services. As a medical professional who sees the patient routinely for medication refills, they're often the first person to understand if a patient is missing refills, suffering from side effects, or beginning to have symptoms of their mental illnesses. Now, next up is Sean Drennan.
My name is Sean Drennan, and I'm going to talk about mental health disease prevention and awareness promotion. First, I'll talk about the 3 different types of prevention. Primary prevention is a concept directed towards preventing disease occurrences and major public health problems. Secondary prevention is preventing recurrences or exacerbations of diseases already diagnosed. Finally, there's tertiary prevention, which is reduction of the amount of disability caused by diseases for at-risk populations to achieve the highest level of functioning. Now, I'll mention some of what is going on in mental health awareness. There is a large variety of mental health promotion activities to address all populations, and they are run through a variety of organizations including schools, religious institutions, industries, and government organizations. They are geared towards the enhancement of positive mental health and well-being, as well as self-esteem maintenance and enhancement. In 1979, the Office of Disease Prevention and Health Promotion started Healthy People. Healthy People establishes health objectives and measures dedicated to the promotion of health and prevention of disease. And Healthy People 2010 established 14 mental health objectives. They addressed mental health status improvement, treatment expansion, and state activities. In Healthy People 2020, a new objective dedicated to the reduction of depression through screening and treatment was added to the 2010 objectives. This has been Team K's presentation. Thank you for listening.